how do you see trauma in people? How do people realize if there is any trauma that they need to become aware of and release?
Those are great questions. I think you see trauma in those behaviors that seem really destructive, self-destructive, perhaps inexplicable, compulsive. You have a feeling when somebody is caught up in the grips of something that's, of course, it's within them, but it feels to them, and it may feel to you like it's beyond them. They can't help doing what they're doing. Being angry. You see this often with people with their children. Sometimes I'm aware of sometimes that in myself with my son when I get really angry at something. I think, where is that coming from? Yeah, he's being a pain in the butt, but why am I getting so angry? And I'm realizing that goes back as I reflect on it. And that's the first step, is reflecting on, instead of just assuming that that's the way it is, reflecting on it and noticing, oh, that's my father's anger that's there. And that's the terrible things that his mother did to him that somehow are still living in a slightly mutated form in me because I'm angry in a way that I have no reason to be. So it's not like, when my son is sticking his head out of the window when he was a kid, when I was driving the car, yes, that's real emergency. But when he's just being difficult, that's not a real emergency. That's not something I have to get so upset about. It's coming from somewhere else. So we need to start becoming aware. And that's why meditation is so important, so that we can become aware. So those thoughts and those understandings will come to us. And with other people, that's really often the first step. And then another way of working that I talk about in the transformation that I've been using now for almost 50 years is doing expressive meditations, which are ways of bringing up emotions and feelings that have often been buried and been locked into the body, like those people you see who are sort of walking around like inflamed beings, is that when you get them up and get them shaking their bodies and dancing and just sort of moving around and letting go, all of a sudden, the anger or the fear or the sadness that's buried in the body, that's manifesting as symptoms of inflammation and increased levels of stress hormones and depressed immunity, that the emotions that are often responsible for those symptoms begin to surface with these expressive meditations. And the one I teach, first of all, the transformation, and again, people can see it on our website, is just shaking your body, standing up and shaking for 5 or 6 minutes, and then pausing for a couple of minutes and just breathing, and then letting the body move to music. What often will come up during the course of that shaking are some of those buried emotions, some of those traumatic memories. They will surface in the course of that sort of shaking up of these fixed patterns that are coming out as physical symptoms that you see, the tight, held-in bodies that I see, the speech that's strangled in the throat. You talk with people who their voices are really kind of hoarse and shut down, and often you find that that's a physical expression of a psychological state. I don't feel I have my own voice anymore. So, and sometimes all you have to do, the shaking will bring things up, sometimes automatically. Sometimes it's just a matter of asking people to reflect. What do you think is going on? And we know that information is available to us. And a lot of the work I do is with techniques like soft belly breathing, like shaking and dancing, like drawings and guided imagery that help give people access to these emotions that are both responsible for and the result of trauma that live inside us.